Hi, my name is Toni Spellacy. I'm a student at Santa Clara University studying public health sciences and biology, and this is my project from the summer 2023 fellowship. This is my equity study. So some background on the why behind this project. I have a passion for health equity, and I have some experience working in this. So I've volunteered in a hospital before, and I've done research on equity in some of my courses. So when I got to this fellowship, my supervisor had a goal in mind for me, which was to look into requests from the county and see where there were gaps in the services of the vector control district. For this, we had to focus on a couple of demographics, so we chose income brackets and language to narrow down our search, and the data for this came from service requests and inspect and treats from the district, and then demographic information from the Santa Clara County Department of Public Health. So some challenges and considerations for this project. Firstly, we had to decide how to divide up the county effectively for our analysis. We looked at zip codes and cities, but found that these were a little bit too big and block groups were pretty small. We wanted to look at a community level, so we decided on a small city/neighborhood shapefile that was acquired from the County Public Health Department. I was also given data for both inspect and treats and service requests, and decided to use service requests primarily for analysis because they gave us an objective view of what the community was actually asking us for. For communication, I was in extended conversation with the Public Health Department in acquiring data for this, and for software, we used ArcGIS and tools like Summarize Within, Attributes Table, etc., which was new for me but very helpful. A little bit into the process that we used. A shapefile was used from the Public Health Department that broke the county up into about 110 sections that we could analyze. I used Summarize Within, an ArcGIS tool to count the service requests in each neighborhood, and cross-reference this with demographic information from the Public Health Department as well to see if income or language was significant. And finally, compare this with route sites to see, regardless of the requests we're getting, are our services equitable throughout the county. This is the heat map I ended up making with the data that I had. The red represents more calls per person and the yellow represents less calls per person. So as you can see in the regions on the outside of the county, although they are more rural, we're getting more calls density from there, while downtown and in the center of the county, we're often getting less calls. To further analyze this, I used a confidence test, which is a statistical test used to determine what is within accepted bounds of error and what is significantly different from the average. So the confidence test used standard deviation, average, and a set percentage to categorize values as high, low, or average for call rate within the study. So in the middle would be average calls. Anything below that number 0.01363 would be considered a low call rate, and anything above the high average there, 0.01821, would be considered high or above average call rate. This was the map that I made using the confidence intervals. So all of the regions of high, significantly high call density are dark blue. The white is a significantly low call rate, and the blue, lighter blue, is average call rate. For these next statistics, all of the low call regions were grouped together and all of the high call regions were grouped together. So for income, the average median income of low regions was about $77,000, while the average median income for the high regions was about $128,000. And then for language, percent reporting speaking language other than English at home in the low regions was about 58%, while percent speaking another language at home in the high regions was about 38%. So we can see that language makes a significant difference in call rate. Here are some graphs made from all of the data regardless of the confidence intervals. So on the left we have service requests by income. So as you can see, there is a high positive correlation. So higher income means more service requests, as we've seen. And on the right, we have language, so service requests by percent speaking language other than English at home. So as you can see, as more people are speaking another language at home, we have less calls. Another consideration we wanted to look at was route sites. So this is where we are servicing and setting traps. So regardless of the calls we're getting, are we equitably servicing the county? So here are the graphs made for route sites per person versus income on top and versus language on the bottom. So as you can see, there is no positive or negative correlation for these two factors on route sites. So we know that in conclusion, we are going to focus on call rate and service requests in our targeted outreach to the low call regions. And thank you for your time.